All right, so it is my pleasure to introduce our next speaker, Dr. Kogon, who's a clinical associate professor and a member of the Center for Integrative Medicine at Stanford. She has expertise in managing cancer distress. And today she's going to share with us her expertise regarding living with uncertainty after cancer diagnosis. So please join me in offering her a very warm welcome.
Good morning. Can everybody hear me? I usually don't use a microphone unless it's a problem for anybody. Okay? So we're switching gears. You just heard what you can do about your cancer and how to get rid of it. And now we're going to talk a little bit about how you might feel and why you might not feel well while you do that, and what you can do to feel well in that process. So we have 15 or 20 minutes to cover a huge area, and it's a little bit like, I don't know, going to New York and saying, let's do sightseeing in an hour. And what you can sit on the bus and race through Manhattan and say, there's this, there's this, there's this. Or you pick one thing and say, let's discuss one important thing. So I'm trying to do a little bit of both. The one important thing is uncertainty. You know, we all want certainty in life. We want things to work out. And our minds center around certainty and often struggle to live with uncertainty. So I'm going to discuss that a little bit, show you the impact on health and what you can do to maintain health even in the face of uncertainty. So usually when we say uncertainty, we talk about, oh, you know, I might get run over by a bus tomorrow. That's a sentence we often say, but not really mean. You know, we're not really thinking about that. And what it ultimately expresses is, I have no clue what happens tomorrow. That's actually true, but we live as if it's not true. And medical uncertainty is very, very challenging because the discrepancy of what you want to happen and what doesn't always necessarily happen. And I'm using history to make my point. You know, when I was born, and a lot of you were born around that time, medicine used an authoritative, sometimes also authoritarian approach. You know, I would stand there. I mean, I wasn't born, but I don't know, my ancestors would stand there and say, okay, you're sick, now we're going to do this. You know, sometimes there were threats involved. You really got to lower your cholesterol, or you really can't eat that sugar cookie. And for you as an individual, at the time, it sometimes worked. You know, physicians did wonderful things then, but sometimes it didn't work. And as we evolved in medicine, and by the way, that approach is still true. Some of you face situations where there is no clear approach. There is no trial. You might not be able to do a specific surgery. And you have to trust someone who says, I don't really know. It might or might not work. And you put the trust in that person's hands and go along with what that one person says. So it's still true. But, you know, when I was in medical school, they said, we can't just trust doctors. You know, that was a good move. Or one doctor. We got to look at medicine and take people and apply medicine to groups of people. You know, we got to separate from what works from what doesn't work, and what you see on the bottom is what's called a normal distribution curve. You know, we give medicine to a lot of people, or we do surgery to a lot of people, or we do radiation to a lot of people, and then we'll hope to catch as many as possible out of that curve of everybody. And again, for you as an individual, you know, we're now 80s to now. We're still doing that. You know, we know from studies, we give you a medicine, we do a certain procedure, and it captures X amount of people, and we're very happy about that. But it also doesn't capture X amount of people. And that's what uncertainty is about. You never know, regardless of if the doctor says something or a trial showed something. When you undergo that, whatever it is you're undergoing, you have no clue whether or not it's going to work for you. And that is incredibly, incredibly hard. I can tell you, You have a 99% chance of something working. Sounds pretty good, but I have met that 1 out of 100 people for whom it didn't work, and that can be devastating. And what does that mean to you, and how can you deal with it? So now, I'm not the right person to talk about this. We're now in the day and age of targeted precision medicine. I saw a genome person, so you will hear a lot about that. That's our attempt at individualizing medicine. Now we make it even better. I said authoritarian to evidence-based to individualized. We're now looking at you specifically. And so over the years, we're catching more people whom we can really help, cure, or at least help them live with disease. But again, for you as an individual, it might or might not work. That's what uncertainty is. And to live with that, to be comfortable with that, I haven't met many people that say, oh, no problem, I'm about to do something and it might or might not work. So uncertainty also affects how you make decisions. And that's very, very challenging. Every time, and that's not just medical decision making, you make a decision, it has a good outcome or a bad outcome. And I'm purposely taking an example that doesn't affect, head and neck. But a woman who makes a decision to have a mastectomy, to preventively avoid cancer from returning, she might succeed. I'm doing something, that's the green cross. It has a good outcome. My cancer isn't coming back or progressing. Or it can have a bad outcome. Even though I did that mastectomy, the cancer still came back. And the other way, it's true also that I don't take a decision. I heard Dr. Rosenthal about talking about studies, and some of you were talking about, dryness of mouth, side effects. So even if you make a decision that has a good outcome, you live, you might pay a price for it. And how do you weigh, as an individual, that balance when you make a decision? So from an emotional perspective, those 4 quadrants are very, very different. We all want to be in the quadrant of not doing anything and having a good outcome. Unfortunately, it doesn't work that way. And ideally, we want to be doing something and have a good outcome and don't pay too much of a price. So this is to give you a flavor what you all live with every day. From an emotional perspective, is very stressful. So now I'm trying to prove that point. So maybe some of you, there are people who are very rational. They look at the data. They say, okay, I have a 50-50 chance of something, or a 90-10, or a 10-90, whatever it is, and I can live with that. But the people I work with don't. I personally suck at it. And in general, the people I meet in general life, my experience is that they're not that good at it either. And why is that? For that, we have to understand a little bit about animals, because we're an animal also. Robert Sapolsky wrote a lovely book about stress, because what I'm discussing, uncertainty for the body from a physiological perspective, is stress, distress. And when we compare that with us, it's not as easy for us to dance like it is for zebras. We do get ulcers. And particularly in these scenarios, I encounter lions at Stanford all the time. And zebras, they run. We're scared. We run also when that scenario happens. And now imagine, you walk down University Avenue and that happens. The zebra and you will behave similarly. But what happens? This is a dividing cancer cell. So if the lion is now a cancer cell in your body, the zebra doesn't really care because it doesn't understand. So it can dance, but you can't. And to make matters worse, even if you don't have cancer, you're cured, but the thought the cancer might come back or any variation of the theme, zebra doesn't care, but again, you care. So you notice that the little person on the right side never changed. So regardless of the lion standing in front of you, or a cancer cell being inside of you, or you thinking about a cancer cell being inside of you, from a physiological perspective, from a stress perspective, from a body perspective, they're very similar. And that's a tough sell. So now we're racing through Manhattan and we're driving by, Times Square, and we pause. This is the one thing. If you take one thing from today, take that, because it's a tough sell. Whenever I have this conversation with people who say, no, well, what are you talking about? A thought doesn't have an impact on a body as a line. It actually does. Oh, you want to take a photo of that one thing? That's good. Thank you. And this is you. And this is you with thoughts, emotions, and your body. I said it has a big impact, what we think on our bodies. And I'm glancing at that clock. Okay, I have like a few minutes. These are the thoughts that happen. This is a generation of your brain. It pops out. Some of it might look familiar. And sorry, I'm racing with the bus because I have so little time. So if I'm going faster than you can process, I will tell you when we're at ground zero. You might have these emotions, and your body has all kind of stuff. So differentiate. Going forward, I'm starting to guide you into what can you do about all of this. Thoughts, emotions, and the body, and they're closely related. The important thing, this kind of stopping at Times Square 1 second, thought and emotion happen spontaneously. I always meet people that say, well, I shouldn't have this feeling, or I shouldn't have this thought. Guess what? You will. It's like going to the bathroom. It's like sneezing. If I tell you, don't sneeze, it's hard to hold it. Thoughts and emotions are no different. If that's, information number 2 you take from today, I would consider that a success. So let's look at how this all circles around with each other. They are all closely related. Thoughts affect body, body affect emotions, emotions, you name it. And I give you an example that you might know from yourself. There's a bump here, or, you feel a twinge, and your thought is, I forgot what I wrote. Oh, I can see here. I wonder if this is related to cancer. You have no clue what it is. It could be a pimple. But how the way the mind works, it has a tendency to put something there. There's another category of people you will see in a second that say, oh, no, there is no bump. That exists also. And the emotion that comes with that is fear. Fear has a deep impact on body, our physiology, and thought, which usually what happens when you are fearful, you don't sleep, people get headaches, the typical stress symptoms. And guess what? Now you can even think about what the headache could mean. Oh my goodness, I might have brain metastases. This is all real stuff that happens in people's existence. And guess what happens then? You're even more fearful, and then you're convinced that it is cancer-related. So fear, as it expresses itself physically, it thwarts thinking. It affects attention, memory, recall, processing. You are not good at making decisions in a state of distress. And so to illustrate the point of the people saying, while you're waiting, you can contemplate symptoms that you don't even have yet. So that's one variation of the skin bump. It's not there. The variation of the skin bump that we know is cancer, but the opposite is true also. There is a big bump, and I have it under control. No problem. There is no bump. So again, this is the illustration of how it affects your body negatively. And this is ultimately what uncertainty represents. So the 2 little comics showed you, one said it will happen, even though you don't know if it happens. And the other person says it will not happen, even though it's obvious that it is happening. And the reality of life is, this is what uncertainty is. Can you get comfortable with not knowing? You make huge decisions every day that you want to optimize outcome for the future, but you don't know. Very stressful. So why is all that? T.S. Eliot said humankind cannot bear much reality. I don't know what it's about the human condition that we suck. That's how we are different from the zebras. They don't have that problem. They just deal with the reality of a life-threatening danger, or they ignore it. And so in the 4 minutes I have left, I'm still racing in my bus in Manhattan, and hopefully throw you a couple of things that you can take from today. We can spend an hour just talking about what can you do to actually feel better and not have these overwhelming thoughts that then can get out of control or affect your decision making, or your spouses. I'm sure you have caretakers here that themselves have those kind of thoughts out of fear for you as a patient. And so that one picture that a nice photographer took, keep that in your head. If you realize and can accept, even though it's always a tough sell that I fail to sell to many people, your body cannot differentiate the thought, I have cancer, from a lion standing in front of you. For most people that's true. And so you have to act accordingly. You have to accept the fact that, so again, this is the little person on the right, that's you. And life is on the left. It could be anything. It doesn't have to be a cancer cell or a thought. It could be arguing with a spouse. Life is you being in a constant ping pong with events outside of you. But as I demonstrated with that, or illustrated with that picture where you cycle on yourself with a thought after an event happens. Let's assume you go see the doctor and you could be cured. And the doctor says your cancer could come back. Doesn't mean it will come back, but that thought sets that whole machine on the right in motion. And so I'm trying to think how to best, as we go through the slides, it'll present itself, because that's ultimately where you have some control. One thing I also want you to take, now we're at ground zero. I had this interaction with Heather where I think the flyer says mood disorders. Mood disorders and cancer do not go together. That's a misnomer. So if I take 100,000 people off the street and look at their rate of depression or anxiety disorder, and then I take 100,000 people with cancer, the rates are the same. So when you think of all the things I'm describing, people are tempted to say, oh my goodness, I have anxiety and depression. It's true that you might be fearful, anxious, and sad and have low energy, but do not confuse that with the term of major depressive disorder, anxiety disorder. What you do have, so the signs, about half of the people with cancer have considerable distress. They have a lion in the room. And so don't pretend there is no lion. So acknowledging that there is a disconnect, that's another thing I want you to start doing, is Bessel van der Kolk in a wonderful book says the rational brain is incompetent to talk the emotional brain out of its own reality. So that's another piece where I always argue with people. No, it's not rational. I shouldn't be thinking about my funeral after I'm cured. Absolutely, you're right, you shouldn't. But guess what? The spontaneity of thought will potentially present that thought to you. And so I want to encourage you, when you hear yourself say should, or hear your spouse or child or grandparents say should, that you say, no, wait a minute, if this is a thought or an emotion, then it probably happens spontaneously. And let's not even pretend we can reason ourselves out of that, but what we can do is that we can alter it. So we can alter emotions, we can alter thoughts. So when you have a thought and you don't like it, don't say, thought, you shouldn't have happened. That's like asking your body to not go to the bathroom. It will not comply. But you can say, okay, now that I had that thought, would I rather have another thought? Can I create a thought? And the mind is interesting. With the creation of certain thoughts, the emotions tag along. So if you think cancer comes back, I illustrated that already, very high probability of your body not liking that thought. But if you connect to mentally something that happened recently that really moved you or made you happy, the mind still stores that stuff. And it can make the emotional connection. And again, I don't try to make light of it like, oh, great, you can just, always alter negative thinking. I know that's ultimately my job. That's what I help people do, to alter that. And it's not easy. I always compare it with learning, if you're not fluent in Mandarin and start today, it's kind of hard, or even Farsi or something, different letters, different language. And so whenever I start this process with people, I tell them, think of it as learning Japanese. You're now 50, 60, 70, 30 years old, and we're now learning Japanese. But it can be done. And so in that process of altering that, a fundamental piece also is to realize these thoughts represent uncertainty, which we hate, and to start looking at yourself not just being composed of thoughts, emotions, and body, but needs. When I say, whatever, the cancer might come back, that's an expression of uncertainty, and we like predictability, we like certainty. Humans like control. They like a sense of manageability in their lives. They also like meaning, and that's another avenue you can address. So you might not be able to totally control your cancer, and you can't always predict what it's going to do, but there is plenty of predictability you can bring into your life. Some of you might have noticed that you become more controlling as you got diagnosed. People sort closets, or they start cleaning like crazy, and it looks from the outside a little weird, but it's just a wonderful way to get what you cannot get with the illness, but you want it, which is, a sense of manageability. I can manage my closet. I mean, actually not my closet, but maybe some of you can manage their closet. And one last thing. Okay, one more minute. Okay, I see that clock back there. Most of us have an impulse to act. We have thoughts, we have emotions, and anybody who watched Mad Men knows when Rose, and I can't even remember the scene, but he says to Dawn, people do anything to alleviate their anxiety. And that's what we do. So in this pairing on the left of thoughts that are automatically associated with emotions, how am I going to act on it? Can I separate the process of thought and emotion being twins and really unsettling me, and then acting in a way that might not serve my best interest? Or can I say, okay, I'm just thinking this stuff, I'm totally freaked out, but just because I'm worried that my cancer comes back doesn't mean I gotta spend my 401k. And can we stay rational in the face of that fearful thought-emotion combo? Questions? Sorry for the racing through Manhattan, but that's what we do in 20 minutes. Any questions? No questions. I stumped them.